Hello, everyone. I think I'm live now, so if that is the case, then hello to everyone. My name is Councillor Katherine Dunne at the London Borough of Hounslow. I'm the Cabinet Member for Communities and the Climate Emergency. It gives me great pleasure to welcome all of our online viewers to mark this year's LGBT History Month. This event aligns with our aims for providing this kind of event, and we've also done events with our partners for Black History Month, for International Day of Persons with Disabilities, and we'll be doing events for International Women's Day. And this year, and the tail end of last year, all of these events have focused on the impact of COVID-19 on equality groups. So consistent with this year's focus, Hounslow Council is very pleased to be working with Metro Charity, with NAS and with IAPT to host this virtual LGBT plus community event. The panel discussion will aim to help awareness of the impact of COVID-19 on the LGBT plus community and to identify recovery solutions with partners and the community. We're marking this year's LGBT History Month, which has a theme, body, mind and spirit. So that really fits in as well with what we want to highlight, particularly the effects of COVID-19 on the community, and particularly around mental health, around wellbeing. We're also holding a second event to mark LGBT History Month, and that's on the 25th of February at 6 p.m. with Gunnersbury Park Museum. And that will be a celebration of the lives of local LGBT plus icons, including the singer Freddie Mercury, the author Ian Forster and television presenter Claire Balding. So you can register your interest for this event as well, for that event by Eventbrite. Taking us back to this evening's event, beyond the discussion we're having this evening, we will be focused on taking work forward in terms of how we can continue interacting and engaging with the LGBT plus community in Hounslow. So if you are watching and you're from Hounslow, from the borough at all, and you're interested in being involved in this work, then please do contact Metro Charity, or you can contact me or Richard or any of the councillors, and we can put you in touch with the right people. So as I said, very pleased to be here tonight, and I will hand you over to Mark, I think. I may have got that wrong.
Thank you, Katherine. What we wanted to do is perhaps hear from all of the councillors we have with us this evening first. So I might invite Richard to have the next focal point, if that's okay with you, Richard.
Yes, of course, Mark. Good evening, everybody. I'm Richard Eason. I'm a Labour and Cooperative Councillor representing the Osterley and Spring Grove ward in Isleworth. Yeah, I've been a councillor since 2018, and I believe that I'm the first out LGBT councillor within the Labour group for at least 15 years. So that's yeah, it's an honour and a pleasure to, but also a little bit worrying in terms of numbers and proportionality, because Hounslow as a London borough, we believe the LGBT population is probably around 10%, which is sort of the London average. We see no reason that it will be markedly different in Hounslow. So 1 in 10 people in the borough will identify as being lesbian, gay, bisexual, trans, or other identities under the banner. As I've been living in this borough for about 20 years, and when I first came to the borough, there was quite a vibrant commercial LGBT scene. We had, I think, up to 5 different gay pubs, as we'd call them, at various stages, places like the George, the Queen's Arms, Windsor Castle, or the Birdcage in Chiswick. Now they're all gone. There is no visible LGBT scene or identity in the borough. Everyone is sort of online, or relying on the scene and commercial venues in central London or other parts of London. So we'll talk about what impact that has had on social connections and well-being later in the evening. But I think it's important to note that what we've lost over the years. And we'll also talk about the pandemic and the effect that's had on community members and on the community. But over the last year, that hasn't been the only challenge our community has faced. We've had significant pressure on our trans and non-binary community because of the issues around the lack of reform of the Gender Recognition Act, something which was promised and consulted upon 2 or 3 years ago, and has not happened. And elements of the media has been used, that has been weaponized against parts of the LGBT community. So, as well as the pandemic, we've been affected by that. So I think in scene setting, that's really what I want to say. And if I could now pass over to Jo. Thank you.
Thank you, Richard. And thank you, Catherine. So yeah, great introduction. I'm Jo Robinson. I'm head of HIV and mental health at Metro Charity. So Metro has been an equality and diversity charity. We've been going for over 35 years, and we run services across London and the South East. And yeah, we're really pleased to be trying to support local residents in Hounslow who identify as LGBTQ with a range of, in a range of ways. And so we're really pleased that we're able to host this, co-host this panel with the councillors. And so I think the first thing we'll do is we'll do a quick round of introductions. So I'm going to just ask the panelists just one by one to introduce themselves, and just maybe briefly give us your name and also where you work or what community you're with, and then we're going to kick off then with the first question. So I'll just invite you in one by one. So I'm just going to ask Rosanna if you would introduce yourself.
Hey everyone in Hounslow, and shout out for LGBT History Month. Thanks for having me. My name's Rosanna Durham. I'm a youth worker at Metro, and I lead one of the youth groups there for LGBT young people aged 11 to 19. And also co-facilitate a mental health support group for LGBT adults, again in Metro. Before the pandemic, that was regularly attended by over 50 plus LGBT adults across South London. And we've been running that as an online group during the pandemic as well. Thanks for having me.
Great, thanks, Rosanna. And then just would like Parminder to introduce herself.
Hi, happy LGBT month, everybody. My name's Parminder Sekhon, and I am the CEO of NAS. NAS is just in the neighbouring borough in Hammersmith and Fulham, and we've been there for 30 years, and we serve Black, Asian and minoritised communities right across London, and have seen many residents from Hounslow as well. And so hello everyone, looking forward to the evening.
Thanks, Parminder. And then I'll just invite Soraya to introduce herself.
Yeah. Hi, everybody. My name is Soraya. I'm a wellbeing practitioner at Hounslow IAPT service, which is within West London's mental health trust, NHS trust. IAPT stands for Improving Access to Psychological Therapies, and we basically provide therapeutic support for all adults age 18 up within Hounslow. So we provide that through many different means: one-to-one therapy, groups, counselling, cognitive behavioural work. And I am the LGBT lead within that team. So I lead on work relating to this community.
Great, thanks, Soraya. And then Carolyn.
Thank you. Hi, everybody. My name's Carolyn Regan, and I'm the Chief Executive of West London NHS Trust. We provide a whole range of mental health and community services across West London. So Hounslow, Hammersmith and Fulham, and Ealing next door. I've worked there for about 4.5 years, and Soraya's mentioned the talking therapy services, which is one of the offers. I'm also an out lesbian. I've been out for about 35 years, so I'm reasonably well known for that, but also trying to make the NHS generally a more diverse and inclusive place to work. And I live in West London. Thank you.
Great, thanks, Carolyn. Welcome. And then Caitlin.
Thank you. Hi, my name's Caitlin. I work for the same service as Soraya, so the Hounslow IAPT service. I'm one of the assistant psychologists there. So I won't go over what IAPT is again. We're part of the same team.
Thanks, Caitlin. And then just get Mark to introduce himself as well.
Hello. Very delighted to be joining this panel discussion. I also work at Metro Charity alongside Rosanna and Joe, and I look after our external affairs. So that covers things from communications through to policy and research.
Great, thanks, Mark. So that is everybody. Don't want to miss anybody out. Slightly weird when you're not physically in the same room together, but I think we've got everybody in now. So yeah, so I thought we could just kick off with a sort of quite broad question to begin with, and yeah, just invite maybe everybody would like to say a little something on this question. And then as we go, we ask different questions. I might just bring certain people in if I know that they have a particular background in the area. So the first question is, what do you think the impact has been of COVID-19 on the LGBT communities that you are either part of or work with? So it'd be really good if maybe you could just give us one or two ideas of what you really feel the impact has been. And I'm just going to ask Parminder to kick us off with that question. So we'll do the famous "you're on mute," most common phrase of the year.
So your question, Joe, about what's been the impact on LGBTQIA people during the last 11 months. And I think in many ways, the impact's been undeniably clear, very well evidenced. It's and I say that, I suppose, from the perspective of being an Asian lesbian that is part of the LGBT community and is also part of the Black and Asian minority community. The impact's been disproportionate, I think, for the communities that I work with. There's been a lot of trauma and a lot of loss. And it's not been one discrete incident of trauma. It's been a long, relentless 11 months of trauma. And I use that word because, you know, we are part of a set of communities that some of us have only recently kind of enjoyed our civil liberties in terms of coming out, in terms of having equality around issues like adoption, marriage, armed forces, something as basic as giving blood. And then all of a sudden, when some of those civil liberties are curtailed, we can't go out, we're in lockdown, we don't have access to our chosen families, because many of us have had challenges, some of which we may have overcome when we come out to our families, and some of us don't. And so we create our new families, and then when we can't see those new families, I think it's really, really challenging and difficult. And we already know that some of our members of our communities are barely keeping their heads above the waterline, because we know what the disproportionate impacts are in terms of health outcomes around self-harm, around suicide, around eating disorders, around HIV. But we're resilient, definitely, you know. If I'm talking about BAME communities, I mean, if we can survive being criminalized, if we can survive slavery, if we can survive colonialization, you know, we are pretty resilient. But I think the last 11 months, where there's been so much economic, social disruption, history has taught us that those that are on the edges and on the margins of society very, very often bear the brunt of the worst outcomes. So I'm not going to go through, you know, all the disproportionate impacts, because I think they've been, you know, on the 1 o'clock, 6 o'clock, 10 o'clock news. Everybody knows that. And LGBT populations are part of those communities. So that isolation and inability to make those connections, find those safe places. As Richard said, you know, those safe spaces are kind of critical for us. They're life-saving places. And now we can only access them through being online, and not everyone can access online things safely. So I think the impact has been significant and huge, and only in time will we truly be able to calculate the true cost of it. That's just a few of my thoughts.
Thanks, Parminder. Yeah, and it was great that you brought in, you know, we're not just LGBTQ folks, are we? We all have a different, we have a racial background, we have all sorts of factors about us. And I was thinking it's been a massive year in terms of the death of George Floyd and the impact of that on our communities as well. We're aware Hounslow is a very diverse community as well, particularly ethnicity-wise. So we may well come back and just touch on that intersectionality a bit more. Yeah, thank you. And then I'm just going to ask Rosanna if you might just say a little bit, and then I'll just open it to the others then. And if you give me a wave of your hand if you'd like to come in, that would be great. So Ro, could I just ask you to just say a little bit about the work you do?
Yeah, thanks, Jo. It's been a really challenging year, and yeah, thank you to Parminder, kind of shout out to some of the headline issues that you've drawn our attention to around mental health. Of course, we all know that being LGBT does not mean it's not, you know, it means that you are at higher risk of certain things like social isolation, anxiety, depression, and yeah, not to kind of lay it on heavily, but yeah, during the pandemic, I've just really seen in my work the toll that's taken on service users, young people for whom being at home isn't actually a safe place. You know, if you're a trans young person, perhaps you're not out to your family, or it's not safe for you to come out. And so historically, LGBT youth groups have been one of the the places that you can go, find mental health support, make friends, and develop peer connections that will nurture you and kind of give you a sense of self-confidence and rootedness. And those opportunities during the pandemic haven't been open to groups of LGBTQ people, young people particularly. And through my work, I've seen a noticeable increase in self-harm and suicide risk as well. And that also includes the LGBTQ adult population that I've been working with. Already, many of those adults are socially isolated. During the pandemic, a lot of them have been living alone, unsupported, perhaps not being out to neighbours or even visible in their community. So yeah, there's a lot that the communities had to weather, and the online groups that Metro have been running are often called a lifeline by service users.
Thanks, Rosanna. Yeah, no, I was just to draw it together. I was thinking, you know, the general population has had all of these. We've all had issues with mental health, haven't we? And then it looks to me like, you know, with this LGBT community, it's like our issues are compounded. So things like isolation can be linked to sexual orientation or gender identity, and then it can just compound the isolation that everybody's feeling anyway. So yeah, so plenty to talk about. So why don't you give me a little wave if you'd like to come in? Yes, Carolyn, great. Good to hear from you.
Thanks, Jo. So I just wanted to add to what's been said, and I guess I would have started with social isolation, because I think it's been a really difficult year for everyone. And it's certainly compounded for LGBTQ groups of people whose support networks may be very diverse and who may not be able to receive the emotional and practical support from their chosen family and friends. And I think that goes for kind of all age groups. So I would certainly pick that as one. And then the second one I just wanted to mention was around access to healthcare. So we know that the experiences of LGBTQ people of accessing healthcare is not always a positive one. And I think it's been really difficult during the pandemic for a number of reasons. People have been hesitant about approaching their GP or their community service. People have been worried about the spread of COVID. And I think at a time when our ability to access healthcare is a challenge, there are other barriers, such as you've got to be good with the technology, something that I'm definitely not, so that you can actually talk to someone. And I think all those things have not helped at all. And then I think there's economic worries and anxieties on top of that. So it's really multi-layered and very difficult, I think, and we're still in it. So those would be some of my thoughts.
Great, thank you, Carolyn. Anybody else want to chip into this question? We do have lots of other questions, but I'll just see. Yes, Richard. Yeah.
Yeah, thank you, Jo. Echoing some of what other people have said, definitely the issue of isolation and the fact that our social networks are perhaps more geographically spread than maybe many other people and many other parts of the community. So certainly as a gay man, I kind of rely on socializing in pubs with friends, and of course for quite a large period of the last year, pubs have been closed. So that just has not been possible. Not having a place to meet friends, and then the lockdown scenario. I'm thinking that I've probably only seen one of my friends in the last 3 months in person. the person I sort of share a support bubble with, which is a really strange sort of situation. I've got other friends who are more further away geographically, and there's no prospect of seeing them in person for a good while yet. But the other big thing, really, especially for thinking about Hounslow, is employment and the economic harm that the pandemic's done. A lot of people that I know in our community work in retail or in aviation or in the hospitality sector, all of which have been decimated. So I know people who were laid off even before the furlough scheme was available. Employers just terminated contracts at the first opportunity. Others who've been furloughed and off furlough, part-time furlough, not really knowing what's happening, and real uncertainty, and fearing that fearing that they're not going to be able to get back into the type of employment they've had before, and struggling to identify what new careers and new career opportunities there might be. So I think that economic impact is really quite severe, because if you're out of work and you're claiming universal credit, that's living in poverty. It's not social welfare. It very much is poverty, and that compounds all the other issues, the challenges about mental health, and just getting by. Thanks.
Thanks, Richard. And I wonder if I might bring in Soraya or Caitlin, just to maybe tell us a bit more about the Hounslow residents that you work with, and maybe have you seen differences this year to during COVID to sort of previous work that you've done?
Yeah, so I'd be happy to speak to that point. So yeah, I think with the people that I've been working with, of course, there's been a big uptake in people asking for mental health support at the kind of mild to moderate therapeutic level that we work with across the board. Of course, that's partially due to the social isolation, economic kind of uncertainty. One thing that I've particularly noticed that I suppose we haven't massively touched on is difficulties with housing and homelessness. That has been a huge impact. And of course, looking at the LGBT community, they are kind of with higher rates of family rejection. That is something that they can be disproportionately affected by. And that also kind of massively increases the difficulties that they face, both structurally with trying to get access to adequate housing where they're not having to be in contact with too many people, of course, because of having to socially distance, but also being able to live comfortable lives. So that is something that I've really noticed an uptake in. And I guess being specific to Hounslow as well, we also know that we have quite a high refugee population. And again, these issues with housing and economic difficulties can be extremely difficult for that community. I myself have worked with people who are here because in perhaps their own country where they've come from, LGBT lives are completely not accepted, and they wouldn't be able to live free lives at all. And so again, I think there is quite a high population of people with those issues in Hounslow as well. So yeah, the mental health difficulties that we're seeing with the LGBT population are kind of maximised by a number of different factors that we've all sort of mentioned as well.
Thank you. Thanks, Soraya. I was wondering about, well, strangely enough, I was wondering about bringing in Councillor Dunne, so I see you waving there. So, yeah, why don't you, I was just thinking it'd be really good to hear a bit more about the council and about tackling the local inequalities, sort of, you know, how you see the council being able to do that for LGBT folk, given that we're in the COVID pandemic.
Just an easy question then. Yeah, I mean, what I wanted to say was to agree with what everyone's said so far, in really sort of highlighting the issues that are affecting the community, and that are affecting all communities. But there are obviously particular things each community experiences things in its own way, depending on the particular characteristics there. And just one thing that hasn't mentioned is an increase in domestic violence that we've seen throughout the pandemic as well. And although a lot of that is male violence against women and girls, we do know that it also affects LGBT communities, and again that has risen as it has nationally. It has risen in Hounslow. So on that particular issue, that's something that we've been working with our partners, obviously in the police, but also by increasing the amount of resource that's available at the council to support the victims of domestic violence. In terms of the greater inequalities, I mean, that's one of the things that's really plaguing our country, and I believe is one of the reasons why we've had poor outcomes internationally. When you compare internationally with regards to the COVID-19 pandemic, we were an unequal country going into the pandemic. We'd suffered from years of austerity, deprivation and underfunding going into the pandemic, which meant that our communities were not as resilient as they could be when it came to actually, to coping with it, both the disease itself and the consequences of lockdown, as has been very well described by other members on the panel. So obviously, as a council, we do want to be able to do things about this, and it's not an easy task. And we've been looking at it in lots of areas. I mean, not just obviously not just with regards to the LGBT community. We had a big review this year looking at racial inequalities in the borough as well, following the Black Lives Matter protests. And so much of what we are trying to do in different areas kind of follows a similar kind of pattern and design, but it's with the details. It's in looking at the details that will inform how we do things differently when attempting to tackle those inequalities in different communities. And the sort of the pillars in the way that we're looking at it is to look at our strategies and policies. Are any of them inadvertently discriminating against any particular sections of the community? How can our councillors be involved and show community leadership for our different communities? And how can our partnerships with other organisations and the community strengthen and help to fight those inequalities? We're also looking internally to our own structures and our own employees and workforce, and to say, how can we do the best by them as an employer? And that, so starting last year, we have been really trying to strengthen and put in place networks for different protected characteristics and different groups of staff run by them. And so I am pleased to say that there is an LGBT staff network. There is a women's staff network, and there is a BAME staff network in place. And these are the beginning stages, but they are starting to really find out, what is it that, what can they do to help support our staff from different backgrounds, from different groups, to really get the most out of being an employee of the Borough of Hounslow. And finally, we're looking at everything we do operationally, and again looking to see, is there anything we do that inadvertently discriminates against particular groups? What can we do about that? How can we reverse that, not only to prevent any discrimination, but to actively try to get rid of it and to bring about more equality. And that's really one of the reasons why we need to do events like this in partnership with organisations that really understand their communities and can help bring that understanding to the council. It's not something we want to go off and do on our own. It's definitely something that we need to do in partnership with organisations, with structures that already exist, but then to really find how we can reach people in our own community. So Richard described about the gay scene in Hounslow and how that across the borough, how that used to be actually much more vibrant and perhaps visible than it is now. And that is something really sad and something difficult, that has declined, and it makes it difficult for us as a council to engage with the community when they don't have a sort of base in the community. So again, it's through working with other organisations that we really want to actually be able to engage with members of different communities, including the LGBT community.
Great, thank you, Katherine. So I was just picking up on, I wanted to ask a question about, I'm imagining quite a lot of you have been watching It's a Sin on Channel 4. I see some nods. And I wondered to what extent, what that brought up for me was looking at the gay community in the 80s, how much coming out and shame was very much a part of life in the 80s. And well, I posit that it's still very much part of our lives today, that it is hard for us to come out, and it is hard for us to, in a way, be visible to folks in the council. And I know Richard mentioned him being a visibly out councillor, which is great, isn't it? And I just wondered to what extent you felt like there were similarities, if you've had a chance to watch It's a Sin, and to what extent we're still struggling with visibility, and maybe COVID's it's made it even worse as well. So anybody take a shot at that? A few musings on that, maybe. See Parminder? Yeah, great. Thanks.
Well, yeah, I mean, I cried my way through It's a Sin. It was very powerful. It was extremely triggering. It was emotional, and it was deeply upsetting because it just reminded you what powerful tools of patriarchy, shame and honor are. And they are extremely powerful. They're used because it works, and it has the ability to crush people, crush them in their very, very core. And I just, it did make me think about a little bit like countries that have just received, countries that are brand new democracies after years and years of being colonized. In terms of our rights that we have achieved, some of them, as I said before, I think have been really recent. And I think there's something really fundamental that needs to happen, which is around an honest conversation about acknowledgement, acknowledging people's reality, and then amplifying those voices and those lived experiences, because transphobia is alive and kicking, racism is alive and kicking. There's no debate of, well, is it, isn't it? Yes, it is. And if anybody, you know, can see what happened over the last 11 months, it's not like all of a sudden we've had a wake-up call. I don't think Black and brown people have had a wake-up call. I don't think LGBT and QIA people have had a wake-up call about homophobia and transphobia. I think a lot of people have known that it's there and it's alive, and it's in many ways, sometimes it's covert and sometimes it's very overt. And that's our reality. And we've just, you know, muddled along with it, and we've, in spite of it, we have become resilient, and we have done what we have needed to do to survive and thrive. But not everybody has been able to thrive. And yeah, it was a painful watch. It's a Sin. It really was. But I'm glad that it was made, and I'm glad that it reminds us again about how important it is to look back at history and to remember where we've come from, the activism that we've come out of, the homophobia that we've endured and have come out of, but not to take any of that for granted. Because, you know, Naz was born out of the AIDS epidemic, and 30 years on, we find ourselves in the grips of another pandemic, which again disproportionately impacts BAME communities. So yeah, I think we do have to take a long, hard look at history and have a long, hard look and reflect honestly, how far have we really come? Is it really all rainbows around the door?
Thanks, Parminder. Would anybody else like to? Yeah, Mark.
I suppose, I mean, certainly It's a Sin was a really powerful, very moving, and I agree, Parminder, you know, you do cry through most of it when you're watching. But I think the thing that is so moving about it is the relationships, and from those relationships, how the different people support each other through really very, very difficult times. And that's where kind of we see a parallel in terms of HIV and COVID. So these are viruses. These are things that are infecting people, and it scares people, and it's really quite unnerving. But it also starts to undermine the way in which we normally support each other. So some of the difficulty you'll see in It's a Sin around HIV, of people being worried about having contact with people and how they can support them. We then see that playing out in current times, because actually, unfortunately, we do know more, but actually with COVID, there is a very high risk of transmission. So we are very legitimately having to reduce contact between people. And that just really removes so much of the support network that people normally can access to kind of get them through what are really quite difficult times. So it's really quite scary that we don't have access to those support networks that are really so important to people.
Thanks, Mark. Really good points. Anybody else like to say anything about that last area? Yes, Carolyn.
Thank you. Well, I haven't seen It's a Sin, but I'm really looking forward to it. I think I'm saving it for a rainy day or something, because everyone says it's great and very powerful. And quite challenging. And I suppose the important thing really is to have those conversations, and to feel that people can ask questions, and that would be the same conversations with staff and with friends and with colleagues and with service users and carers. So I think it's really important to be curious and to and ask the questions. And it's the same of COVID. We've had lots of virtual staff events, some safe space for LGBTQ staff, some open forums, for example, about vaccines, so people can ask questions that they want to ask. And I think it's really important that we're open and we listen to people and we respond. And Mark said just now about the transmission point. There have been lots of things that people have said about how COVID is spread, which kind of reminded me, last year of the early days of HIV. So I think really giving people facts, listening to people, thinking about what we're trying to say and do, and being clear in messages, and maybe not assuming that everyone's the same, which often comes up. Well, we've said it once, everyone's the same, and kind of everyone will get it. So working with organizations and partners and listening to people and being non-heteronormative, if I can use that expression. So, don't make assumptions about what people want, what they're thinking of, what their living situation is, who their support networks are, etc.
Thanks, Carolyn. And I think I'll just ask you a little follow-up, actually, because I'm aware about collecting data for people, and you mentioned the COVID vaccine, and I'm aware that there's a lot of press at the moment and a lot of community conversations, particularly about vaccine hesitancy, and particularly amongst Black and ethnic minority communities, which we know in this borough will have quite a big overlap with the LGBT folk. But I'm aware we're not collecting data, I don't think, are we, on sexual orientation and vaccinations? So I just wondered about, we get a bit invisible sometimes, don't we? I just wondered if you had a sense, being the chief exec of the trust, do you think we get a bit hidden?
Yes, definitely. And I don't think the NHS is very good about having these conversations. We've had probably more conversations in the last year about diversity and ethnicity than we have done in the last 15 years, but we still don't talk about sexual orientation very much. And I think I made a comment that, I've worked in the NHS a long time, but I've rarely heard very senior level conversations about that. There was a GP survey, I think about 5 years ago, that asked about sexual orientation. But I think data is important. I don't think it's part of the census, which is coming up later this year, unless I'm wrong. And data is important. So yeah, I would support that, and I think we should be asking the questions, because if we collect data and if we count things, there's more visibility and things tend to get done. So I would support that.
Great, thanks, Carolyn. And actually there's a question from Carmen in the chat about the census, and will there be LGBT questions on the census? So I just wanted to bring Mark in, because I think you've been following this, haven't you, Mark?
Yes, so we've been working with some of the census teams. So there's a number of teams in each local area who are ensuring that people are supported to complete the census. And one of their key concerns has been ensuring that people know about some of these new questions that are in for the very first time. So there will be some questions on sexual orientation and gender identity for the very first time. And what we've been encouraging people to do is think about completing that, because they are optional questions. But I think, as you were saying, Joe, the worry is that if we don't have visibility of communities, those communities naturally become quite invisible and we don't really know what's going on. And the census is a sort of opportunity that we only have every 10 years to really get a snapshot of the UK. So we very much want to encourage people to answer those questions. The other little bit of information from our chit-chatting with the census people is how do you go about that in a household? Because actually, as we've been speaking about in terms of especially some of our younger LGBTQ plus people, they may not feel comfortable to be out at home. And that's actually part of the challenges that they're facing at the moment, is being at home far more than normal and not feeling very comfortable there. But how do you navigate that in terms of completing the census? So the interesting thing this year is what they're looking to do, this decade is 10 year, is you can request a separate individual census if you don't want to necessarily disclose things on the census of the household. So often what might happen in a household is somebody's completing that on behalf of everybody. So you want to perhaps not out yourself at that point in terms of your sexuality or your gender identity, but you do want to make sure that you are counted, that you are seen. So what you can do is actually request, and you can do this in quite careful ways. So it's not going to send a brand new thing to the house with your name on saying you asked for another census to complete. So there's some nice discreet ways of doing that online. You can do it over the phone and texting them. So it enables you to make sure you're counted without having to come out if that's not something that you're comfortable to do. So some really good progress there. We hope to see some interesting figures coming out of the census.
Great. Sounds like that'll make us all a little bit more visible, which is great. Anybody else want to just pick up on that? Or shall we move on?
Well, I was just going to add, Jo, Carolyn's point about, well, if you're not counted, how can you target services? How can you lobby for resources if you're invisible? And I think that's why it's really, really important that, populations are counted in a meaningful way, and having poor data collection systems are just really harmful, because you can't evidence that you exist and you need something. If you look at, say, take the example of travelling or Roma communities, they make up 0.5% of the UK population, but I doubt very much they get 0.5% of the resources. And it's the same for LGBTI communities, it's the same for BAME. So I think, and a number of marginalised communities. So I agree, data collection is critical.
Thanks, Parminder. And I just want to sort of just pause before I bring Richard in. So I just want to really thank Parminder from NAS for joining us, because you have to sort of segue off, don't you, to another online event. So yeah, I just wanted to really thank you for joining us. You'll probably stay with us another couple of minutes, but yeah, just to say that. Thank you.
Thank you.
I'll just bring Richard in. Yeah.
Yes. Yeah, it's great that there's going to be some questions in the census this year, that we data around our community. But as a council, we also need to make sure that we are asking and collecting sexual orientation and gender identity data wherever that's relevant. So earlier on, we heard about the rises in domestic abuse, domestic violence, and also the pressures on housing and homelessness. So I think as a council, we need to make sure that we are collecting and using data about the people that are approaching our frontline services, and making sure that we understand whether or not that matches the population in the borough, because what we may be finding is that people are not willing to present to the council when they're in need, or are only presenting when things reach a crisis point. So we need to be approachable and able to provide support and services at an early stage, rather than only at a crisis point. So yeah, when everyone's doing a survey, completing a survey, a consultation, etc., those monitoring questions are actually really important for informing our design of services and check on the type of services we're providing. Thank you.
Thanks, Richard. So I wanted to just move on, and I wanted to just take one of the questions from the chat. There's this question in here from Max, and it says, what is the council doing to raise awareness of support and services that are available to members of the LGBTQIA+ community in Hounslow? And also, I'm going to throw in a follow-up, if you can cope, which is, what are we doing as the LGBT community to take more active participation in the council, and, you know, as sort of citizens ourselves, and to support each other? So I sort of, my brain gets slightly perplexed by, you know, I like to see the council as part of us and us as part of the council. So you know, what should we all be doing? And you could either talk from a council perspective or maybe a community perspective, and just that, yeah, you know, what should we be doing to promote and raise awareness of support and services? Who wants to have a go first at that? Katherine, great. You are muted, Katherine.
It would be muted, wouldn't it? I was just saying, I think the way you framed that, and in terms of your kind of follow-up question, I was really pleased to hear it that way, because that's definitely the way I see things as well, that we should all be working together, and the council shouldn't be a sort of us and, you know, speaking to you, but everyone engaging together. Obviously, you know, we do have a role and a leadership role in the community, and so it's partly through events like these, but obviously, you know, just holding LGBT History Month events on its own is certainly nowhere near enough what we need to be doing. I mean, obviously, in terms of support and services, there are support and services that are available to all, and you know, particularly if you look at what we've got represented tonight in terms of mental health services. You know, we work with the CCG and the health service to promote those services to our residents. I think, you know, I think there is a problem in that we don't know necessarily how to reach particular groups, particular sections of society that might be more hidden, apart from through those kind of general channels. And so that's part of the work that I want to be doing in terms of making these links with the community, with organisations that are engaged with those sections of the community, in order to help us get those messages out.
Great. Thank you, Katherine. Thanks for taking a stab at the question first as well. Much appreciated. And Richard, you got your hand up? Yeah.
Thank you. One of the issues, right, so Katherine's referred to the universal services that we've got, and all services should be accessible to LGBTQIA people. And we should all expect and receive a sensitive and appropriate service. But there's lots of things which, as community members, we feel would get a better degree of service from a specialist organisation, and those services are few and far between in Hounslow and a lot of West London. So there are services which are available pan-London. So Metro provides some, and then there is others from the likes of Gallup, Stonewall Housing, Opening Doors London, which is an older people's service. So they are available pan-London, and I think we've got those listed in some of our directories as a council, but but not all our directories, and that's probably comes back on some of us as community members to trawl through the family services directory, the care place, and I think there's several other online directories that the council hosts, and actually look to see whether they are complete and accurate, and actually to purge out of date entries for services which are no longer running. So as Joe framed it, it's yes, it's sort of everyone's responsibility, but yeah, there is, in my view, there's a big gap in terms of targeted services and for universal services to demonstrate very visibly that they are aware, understanding and inclusive. So yeah, I think there's a challenge. There's a lot more things that we need to be doing. Thank you.
Thanks, Richard. And yeah, I just wanted to mention, I was reading a survey of LGBT folk that the LGBT Foundation did recently during the lockdown, and there was two figures that really struck me in there as relevant to this discussion. And one was that 67% of LGBT folks were struggling with their mental health and would really like some support with that, and that about the same percentage also said they'd like to have LGBT specific led service support. So I want to just pose that question a bit more fully in terms of, and maybe just bring in Soraya again from the local IAPT service. I mean, how do you think that more generic mental health services can be more inclusive of LGBT folk? And, you know, how do you sort of see that when people say they want something LGBT specific? Do you think a generic service can also help them?
I think Soraya has disappeared somewhere. So yeah, I'll take this one. We do often kind of, when we're speaking to service users who are from the LGBTQ community, do say that when they've had previous therapy, they've actually found it quite difficult to engage with their therapist because they felt that they didn't fully understand the extent of their experience and what they've gone through. So I do think that there perhaps is an area to have a service that's specific for LGBTQ people. And I think part of it as well is about making sure that staff within our service do have the right training and understanding of how we can better support that community as well. And I do think that we need to do a lot more within our services to make sure that we're keeping kind of training up to date, we're gathering the right data, and we're listening to service users and getting them involved in how we deliver our service as well. And I think that's about having kind of service user groups. So yeah, I think that's part of what more we could do for the community. I don't know if Soraya's back and has anything to add to that.
Thanks, Caitlin. Yeah, maybe I'll just, because I think Soraya is back now. Hi, Soraya. So I'll just pose the question again. We were just, it's great that you're back. We were just sort of wondering a little bit about, I've been reading this survey by the LGBT Foundation, and it said that there was a high level of mental health need amongst the LGBT communities, and also that people would prefer to, sort of 2/3 of them would prefer to have an LGBT specific service. But we were just sort of posing the question with Caitlin of, well, in what way can generic services like the IAPT service really be sort of tailored and able to embrace the LGBT community? I mean, what do you think there? Is it important to have a specific LGBT-led service, or can generic services sort of be welcoming as well?
Yes, yeah. So I recently read a review from Nottingham about the concerns of the LGBT community about the reasons why perhaps they would prefer an LGBT specific service. And I think a lot of it is around concern that therapists that they speak to will have heteronormative ideas, or they won't feel comfortable to speak about those issues, about certain difficulties relating to being LGBT, so that the therapist might not feel comfortable. So of course then the service user is not going to feel comfortable. So what we've been doing is working really hard on making sure that our staff are really highly trained in those areas and in the areas that are less well known about. So for example, in terms of data collection as well, we've just recently added a question around gender identity. So we ask everybody now, and we don't just have the kind of male and female options that we had before. And after adding that, we have also gone on to produce training for staff around what those things mean, because unfortunately there's no necessity for us to have to know about that before we work in this service. It's something that you have to actually change once you're kind of inside that service and add that on. It's not something that every psychologist has to train in, or every person working in the service has to train in. But yeah, it's something that we're working extremely hard to make sure our staff know enough about. I hope I didn't just repeat what Caitlin said. But yeah, so that's how we're working on that, and of course making links with groups like this. Other organisations that are LGBT specific can only make our service better as well. Yeah.
Great, thanks, Soraya. Sounds a bit like both and. Anybody else want to comment on the sort of specifically LGBT-led service or generic services? Yeah, Ro? Yeah.
Yeah, thanks, Soraya. That was really interesting to hear how you're kind of developing staff training around gender identities, and you're kind of getting data as well on it. And for me, it just kind of emphasizes how affirming, how productive, and how needed services that are led by LGBTQ+ people for LGBTQ+ people can be, because service users won't be met by kind of lack of knowledge, negative assumptions, and discrimination, already things that they might be experiencing in their everyday lives.
Great, thanks, Rosanna. Anybody else chomping at the bit to get in on that one? No? Okay. So I wanted to ask a question specifically about the trans community and trans and non-binary people. So the LGBTQI spectrum is very, very large, and we're very diverse. And I think one of my experiences has been often that councils and other public bodies, they ask for our involvement, and then we all know how diverse we are, and actually we've got lots of different needs. So I just wanted to sort of ask you about your own experience of working or being part of a trans or non-binary community, gender diverse communities, and what you feel that the needs of that communities have been during the lockdown? Anybody willing to kick us off? I was about to say, don't be shy, Rosanna, because I know you also do work with quite diverse communities. So I know you answered the last one, but I might just cue you in to start this one, if that's all right.
Yeah, no worries. Thank you, Jo, for being so open and kind of talking to your personal experience. You know, I think as a non-binary person, you know, we are called in our professional lives to kind of talk to trans communities, non-binary communities, gender non-conforming communities, and I like the way that you kind of shout out that in fact that's a really diverse community, and there's a lot of different needs, different people within that area. So yeah, absolutely cannot speak to everyone. I love being a trans youth worker. It makes me so proud, and I feel that I'm looking backwards through a telescope when I work with trans youth, as if I'm kind of reaching out to my younger self and kind of trying to help them nurture positive peer connections, trying to help them feel a sense of agency when they're asking for mental health support, helping them navigate complex systems that are not designed around their needs, and kind of giving them spirit and passion, kind of looking out into their adult life in a landscape in the UK which feels quite dispirited, can feel at times quite dispiriting for trans young people when they're looking at kind of healthcare and options around education and visibility and so on. So yeah, that's all I have to say. But yeah, it's an honour in my work at Metro to kind of represent gender non-conforming communities. And yeah, I think it's urgent work. It's very necessary.
Thanks, Rosanna. Yeah, I'm aware we've been really lucky at Metro. We've got a couple of projects funded for young people's counselling. So we often get young trans and gender non-conforming people, non-binary, coming to us for counselling, and we are able to provide an LGBT specific service. And I suppose one of the areas of our invisibility as a community is we forget we've got lots of different ages as well, haven't we? So I'm aware we'll probably come on to maybe talk about the older age and the specifics there, but I'm just very aware as head of mental health at Metro how many young people do identify as part of the trans community. Many more young people identify as non-binary than older folks, and you know, the surveys is quite strong. You know, of everybody who identifies as trans, non-binary people are the majority, and yet with the media, you would think that all trans people are trans women. So, you know, we've got a lot of diversity within that community, and certainly the services we run, it's been absolutely heartbreaking to hear the stories of young trans and non-binary people, and also parts of our spectrum, just saying how difficult it is to be at home, to live in their true gender, to feel comfortable and confident with their families, and often it is their friends who really help them, but they've just not been able to get to school, you know, not been able to talk to a teacher. So there's a real sort of hidden sort of need there as well. And I hazard a guess there's need at the other end of the age spectrum as well around isolation. So I wonder if we broaden out a bit and just see if people have a sense of, you know, what parts of our communities are hidden. Maybe all parts are. But any further comments on maybe young people and their sort of invisibility in our community? Or do you all work with adults? Carolyn, great.
Thanks. I just wanted to make a few comments on the basis of what you've said, really. So I asked to go to 3 LGBTQ service user groups across the boroughs that we work in, and the biggest issues that the young people wanted to talk about were trans issues and issues relating to them being non-binary, people. And I suppose it was quite a, to pick up the previous comment, it was a sort of hidden group within a hidden group. So that was number one. I think there are discussions now about older trans people, some of whom, are in dementia services. And again, that's another hidden group within a hidden group. So there's lots of sort of layers of complexity. And I think it was Soraya talking about how we need to make sure that the staff working with people are well trained and also well supported. It's quite I think it's sometimes quite challenging for them and for some of the questions and the comments they receive from colleagues. So I think we have a duty to work with and support the staff, but also to offer what people accessing the services really want, and to kind of encourage a wider understanding of very diverse needs within all these groups. And when I went to one of the dementia services, the first thing a senior nurse said to me, "Oh, well, older people who are from the trans community is not an issue here." And I said, well, and someone else said, well, actually, it probably is, but we just don't know what to do about it, or we don't acknowledge it, or we don't discuss it, or or various other things. So I think having that training availability, working with organisations who can support the staff and in turn support the service users, and responding to what people are saying, and keep on listening. So I think there are lots of hidden groups within lots of hidden groups, is what I wanted to say, really. Thank you.
Thanks, Carolyn. Yeah, and thanks for sharing your experiences of, going to those groups and then finding this hidden group within a group, and also really mentioning the importance of training and awareness. I'm aware one of my other non-binary friends says, well, the word non-binary was practically invented like 5 years ago. So we shouldn't all think that we need to be up on the latest identities or terminology, and things just move all the time. So it's I just want to give a real encouragement to all of us to sort of keep an open mind with how quickly things are moving. And I think young people and older people are feeling a bit more confident to talk about their gender identity, particularly if it doesn't fit in a binary kind of sphere. And I know a lot of our young people that we work with, they really lead the way as well. And one of the questions I have for the panel is, I always think we're not that good at supporting each other sometimes intergenerationally. So maybe we can bring in the other sort of age as well, in terms of, what do you think that older LGBT folk and younger LGBT folk could do maybe to support each other? Could you see a sense of a community that spans the ages, and what can we do as the community to help each other during these isolating times? How could young folk help older folk, and older folk help younger folk, do you think? Anybody got any ideas about that? Richard? Yeah.
Yes, thank you, Jo. Yeah, the intergenerational aspect, that is one of the things we've really lost through the loss of physical venues. When we had pubs, gay pubs, there was a sense of community that really did span generations. So and some of those friendships and things, and some of the support has survived, but new connections are not being made, because in the digital world everyone is perhaps within their own platforms, their own age groups, or their own geographic areas, and not meeting the diversity of people that they would have once met in physical venues. I think there was one of the comments in the chat asking about the council's strategy about place, and so there's a theme here about what are we going to do about reinventing our high streets, and making because we now have lots of shops which are have closed down. Probably more, sadly, there'll be more to close. So it is actually an opportunity for us to be thinking as again as a community about physical spaces, and perhaps trying something in terms of some of these disused high street premises, about whether a community centre type or a community centre type venue might be viable and might be a way of using unused spaces, and that could bring in some of the diversity within our own community or communities through arts, through performance, through music, through poetry. So some of the performing arts for the LGBT community, that may be a use for a cafe bar type approach for some otherwise unused units in our town centres.
Thanks, Richard. Yeah, I'm always in two minds to think about our physical locations, but it's so important, isn't it? Because, like you said, it's where we mix together. But also, I'm aware that, you know, when lockdown ends, it's exactly what we all want to do. You know, we rush, don't we? Even if we can only see our next door neighbour or one other person in a park or 6 other people, and before you know it, we're going to be rushing to reimagine these spaces. And I know that's what's on the council's agenda for Hounslow. So yeah, wouldn't it be great if there was some sort of consultative mechanism to involve different groups in the local area, say, to really, because, you know, I think although it feels far off, the idea of a community space that's full of people, it won't be that far off, you know, because that's what we all want, isn't it? So I wonder whether, Katherine, you have something to say about the reimagining the local spaces. Would you be willing?
Yeah, of course. Yeah, I mean, I completely agree that it does give us a fantastic opportunity, and I agree with what, you know, what Richard said, and suggestions there, and I also spotted the question in the chat there, and thought, yes, that's a good idea. We need to do that, and you know, it struck me particularly when, you know, when Richard opened with and as I said before, spoke about the sort of decline of those venues in our borough. Which means that you know, there isn't a physical space for the LGBT community. So would definitely be open to having those conversations, and I'll certainly talk to officers about how we can facilitate that, because it's, you know, it is so important.
Thanks, Katherine. Anybody else want to come in around the sort of physical spaces and maybe imagining what's going to happen post-lockdown? Rosanna? Yeah.
Just by the by, I noticed that the Arts Council are actually funding a piece of research about the future of queer arts venues in London. So maybe I'll share, make sure that link is shared in the comments.
Great, thank you. And Mark? Yeah.
I suppose I was slightly reflecting back on one of your slightly earlier questions, Joe, which was around hidden parts of our community. And one of the things that's really become very obvious as the pandemic's played out and we've been delivering services online over the phone is people can't always access services in that digital way. And I noticed in the chat here, there's a comment around people not being able to be with us or access today, because obviously we're doing this online, we're doing this in a digital way. And I think, although we're definitely learning some new skills and some new technologies and some things that we will take forward beyond the pandemic into recovery, so that we can actually make things accessible online for people. And certainly what we have been able to do is through generous support from various funders is make sure people have access to the technology and also have access to the internet to connect that technology to. But also we're going to see people moving back to spaces, as you say, and people really do love to have that connectivity. So although we're learning some of this digital stuff and we'll keep doing that, I think it's really important that we do get out there and re-engage with people that perhaps we are still missing because of our much stronger focus on a digital way to connect at the moment. So places like a community hub or a community centre, I think will be really key to considering how we recover, because I do worry that although service users that we've been engaging with historically, we've made sure we've been able to support those and keep those service users engaged whilst we've moved to this digital way of engaging. In terms of new people finding us, I think it's really, really difficult. So we need to probably double down on our efforts in terms of community engagement in a very physical sense, you know, out and about, doing pride activities, going to festivals, having community hubs. I think that's a real important thing to do as we move forward through recovery.
Great, thanks, Mark. And yeah, you bring in this sort of vital area of digital exclusion. So it's not always the most obvious people you think of that are digitally excluded. So I just wanted to ask those people who are running services for LGBT folks and you know, running generic services, what kind of patterns have you seen in terms of digital exclusion and who we might be leaving behind? Anybody want to take a pop at that question? What question hesitancy now? It's been a long time, hasn't it? We've been on for an hour and a half. I can see, Soraya, you're going to go for it, which is great. So let's take a deep breath, everyone. We're going to try and stay on for another half an hour. So let's go for it. So yeah.
Yeah, so I guess with our service users, it does tend to be the older population and also people for whom English is perhaps not their main spoken language. I think those are kind of the two groups at highest risk of digital exclusion, and of course that can hugely intersect with LGBT populations as well. So I think those are kind of the main areas we find tricky. At the moment, we have really good access to people via phone. Our service is still able to see people face to face if there is a need for that, for whatever reason. But yeah, certainly with a lot of our services, like having therapy sessions where you want to see your practitioner, or therapy group where you can see people on like Microsoft Teams, that stuff is much more difficult to deliver to those populations that are digitally excluded. Sounds like some of the other services here have been doing work around that and making sure that they can even provide technology, which is really exciting. Something that I think if this goes on much longer, the NHS might need to think about as well. Yeah.
Thanks, Soraya. And Carolyn?
Thanks. I was just going to say, I think it's hugely variable. I think you made the comment that it's not always the people you think will be digitally challenged who are. So I think it's important to keep it under review. Some people say they prefer the phone to a visual, because actually it depends on their surroundings, and they don't always want to be sharing their house or wherever they are visually. So, but they're happy to talk. And I think it depends as well what you're trying to do. So there's a whole kind of range of issues that come into it, and I do think it's important to keep reviewing it and making sure that I think, as Soraya said, we offer different alternatives. You can do this digitally, or we can see you face to face, or we can speak on the telephone, and at different times of the week in terms of services we're offering.
Thanks, Carolyn. Yeah, really good points about access. And Katherine?
Yeah. So just to say, the council is tackling digital exclusion in its different forms through a programme or a series of programmes, looking at what it is that causes people to be digitally excluded, whether it's through just a lack of knowledge that can be solved through education, or whether it's an issue of a disability. And for some people, the issue is poverty, and that they can't afford to have broadband, or they can't afford the digital devices that they need to get connected. And this, of course, affects all kinds of service provision. So it is very much on the council's radar to address some of these things, and it has various programmes to do that. Programmes where people can borrow devices. I mean, obviously, when it came to school children needing to learn throughout the pandemic, the council has provided quite a large number of laptops to children in the borough, but we have to look outside that and see that there are other people who are digitally excluded as well. And so, yeah, that's just something that can be done to help, and then that will widen the pool of people who are able to access services digitally. But we of course have to remember that there will always be some people who cannot and who need things delivered another way.
Great, thank you, Katherine. Yeah, and I think I slightly sort of set the scene for the question in terms of, my own assumption was that younger people would not be digitally excluded and that older people would be digitally excluded. And in a way, it's quite a mixed bag. And, I see there's a comment from Fred in the comments section just saying that younger people often really struggle to find a space in the family home where they can talk have private spaces. I suppose, many people are struggling with that, and we wouldn't normally think of that young person as digitally excluded, but they are, because they can't access the service, say, that we're offering young people's counselling. I know that some of our counsellors work, and the children go out and they walk around the park in the daytime, and they do their counselling session on a phone with the counsellor. And that would be practically unheard of before lockdown. So there's some really creative pieces of work happening. I think I liked what Carolyn said about we've got to just keep in this fluid picture of, well, what works for people and who's sort of excluded and not, and why. So rather than just sort of jump to assumptions. So did I see you raise your hand, Richard? Yeah, you want to come in? Yeah.
Yeah, another angle on this is the consequences of people working from home and therefore working away from, working on their own from home. I think there's a lot of people who are reasonably tech savvy or tech able, but the technology is changing so fast that in a traditional workplace situation, you learn from your peers in a physical space. Now that so many people are working from home, you don't get that equivalent, you don't get that knowledge transfer, and it can be quite daunting, sort of wanting, if you have to change your technology or install new software or new software, if it doesn't work right first time, then it can be a problem. Where do you find the solution? Yes, there's a solution on the internet, but finding the wood for the trees, it's difficult. But that whole work dynamic, I think, would changes things as well. Thank you.
Thanks, Richard. So I want to sort of pose a question that sort of maybe draws things together a little bit before we're going to ask Katherine to make some closing remarks, and also Mark to do that too. So I was just thinking, this is a delicate question to pose in the middle of a pandemic. So we're all aware of how many people's lives have been lost and continue to be lost every day in this pandemic, and we're all aware of the sort of brutalness of it, really. And we've been talking a lot about mental health and people really struggling. But I want to sort of pose a question, and it's maybe sort of looking at the other angle in terms of, what do you think we're learning as people who support people during this pandemic? What if there was a sort of almost like a gift in the tragedy, in the loss that we're experiencing? Do you think it's teaching us something as humans, this real crisis that we're in, that just unfolds every day, not only in Hounslow, but across London and across the world? Do you get a sense of that we might, how might we sort of, is there a learning, is there a gift in the situation that we could sort of take forward? So any sort of views on that, or any sort of last comments that you want to draw in? Who's going to be brave and go for that one first? Carolyn, thank you.
Thanks, Jo. I suppose two things I would say, which I hope stay with us. So one in terms of new ways of working, and I think you described young people walking around the park, and people have been really creative in terms of working with service users and keeping things going. So that, and I hope we continue to review those new ways of working, but we don't go back to assuming that, if you want to see a therapist, you have to pitch up somewhere. It has to be between 9 and 5. I'm stereotyping a bit, but so I hope we hold on to some of the new ways of working where people like them. That's one thing. And I think the second thing I've noticed is staff teams being much more compassionate towards each other, and asking each other about, what's going on in their lives. Some teams and services do that really well, but making time to ask people, what's going on in your life? How's your family? Do you need extra support? And someone's posted a comment about neighbours and strangers who've never greeted me do so now. But I think some services and teams are showing a bit more compassionate towards colleagues they may have worked with for a period of time. And I really hope that continues. Thank you.
Great. Thank you, Carolyn. Yeah, thank you for drawing in Sakti's comment, lovely comment. People we've never spoken to and neighbours, we just can often feel much more connected, can't we? And I think it is in the juxtaposition is the loss that we're all experiencing, and we experience loss on many different levels and in different ways, but we've all experienced loss, whether that's we've lost loved ones, or we've lost our freedom, our ability to get online, and there's all sorts of levels of loss which does perversely bring us closer to people. So yeah, thank you. Anybody else want to have a little go at saying a few things about whether there's a sort of a gift or something supportive in the community at this time? Richard? Yeah.
Thank you. I think we've learnt to value other people more, and I'm thinking particularly about who we value now as key workers, people who've been there throughout the pandemic, keeping things keeping things working. So whether that's people in the supermarkets or other or public services. So in Hounslow, we've been very fortunate that our recycling and refuse collections services have been maintained right throughout the pandemic, and there's lots of places where that's been quite patchy. So we've had people, well, some of us have been working from home. There are plenty of people whose jobs have taken them out every day, and they've adapted and continued with those roles, and those roles have become more and more valuable for the communities. I think we should also recognise just how agile and flexible people are, and we as we come out of the pandemic, we must make sure that we remember that, and we trust and continue to trust people with the personal responsibility for the things which are within their control, and avoid going back to perhaps overly structured ways of working. Let's let's recognise the way that individuals have stepped up, and continue in that vein. So thank you.
Thanks, Richard. Yeah, thanks for bringing in that. We were a lot more responsive and flexible with each other, I think, aren't we? And a lot kinder. And we also appreciate, I noticed Fred in the comments says, well, everybody realises they can be affected by mental health issues, which I don't think we would have been saying a year ago. There's a real taboo around mental health issues usually. But I mean, how many of us have not said, I feel anxious, I feel low, I feel stressed in the last year? So there's something about that coming together in adversity as well. Anybody else? A few last comments, or anything you found? Rosanna, yeah.
I hope, reiterating a little bit what's already been shared, I just hope that there is a legacy for online support services, for instance, online youth work. And I think youth work in particular, the online provision has really opened up lots of opportunities to access young people who aren't or haven't been in the past confident or felt safe to kind of attend in-person services. So I think in terms of engaging with young people, chat-only groups, that it's actually opened up a lot of really exciting avenues. And for some of those young people in LGBT communities, I know that they found those online youth services safer in some ways. So, yeah.
Great, thanks, Rosanna. So I might just ask Mark to come in now. So Mark, I believe you're just going to tell us a little bit about some of Metro's next steps with the Borough of Hounslow, and then we're going to just cue in Katherine to do some closing remarks. So I won't thank the panel now, because I think we'll do that in a bit, but I'll just cue in Mark just for this last bit now.
Thank you, Jo. we've been chatting with the borough because we're really keen that this is perhaps the beginning of something rather than just a panel discussion and then we stop. And obviously we've had some really nice comments coming through here that we get to see on our screens this end as they come through. We haven't been able to highlight all of those or necessarily answer everything, but we will take all of that away and feed it into what we're thinking in terms of next steps. So as I said, in conjunction with the borough, what we'd like to start doing is looking at how we might develop an LGBTQ plus network in Hounslow, something that would initially be facilitated by Metro, but not necessarily always be Metro. It might be that people come together in the borough and they want to set up their own thing. And that would be amazing, and we'd be super happy to support that. But what we do want to do is get that ball rolling and really start thinking about how we might engage people in such a forum, and how that might come together and what it could turn into, which I think could be really exciting and really helpful, especially in terms of people were commenting about how do people know about what the LGBTQ plus services are, what the different support groups are, what hopefully physical meetings will be happening in the future as we move into recovery. All of that sort of information, if there's a way in which that can be shared, I think would be amazingly useful for residents in the borough. So if you would like to get involved, you can message us on any of our social channels, that will get to us. But also if you prefer emailing, that is absolutely fine to do as well. So you can give us a email on membership@metrocharity.org.uk, and we can let you know about how that is coming together and when we might first meet, which I suspect will be digitally first, but certainly physically after, but not forgetting that digital can still happen in recovery.
Thanks, Mark. Great. So great to hear about the development of a forum for Hounslow LGBT folks and residents. Fab. And so I just wanted to invite Katherine, because she's just going to give us a few closing remarks. Oh, I'll say it again.
I messed that one up, didn't I? I messed it up anyway. In closing, no, what I'd like to say is just some personal reflections from me, from what I've learned from this session this evening. You know, not being from the LGBT community myself, but I've learned about some of the needs of the community in Hounslow and beyond, no doubt. And you know, there's that need for engagement with the council, with services and so on. The need perhaps for tailored support, whether, you know, that's particular services for the community or, you know, general services, but with a deeper understanding there of how they can serve the community. And there's the need for data for us to understand, to have knowledge about the community in order to be able to serve it. And there's the need for physical spaces, which came up throughout the discussion, not wanting to leave behind what we've gained by doing lots of things online. And I know that other panellists have picked up on that as well. And I think there is so much that we have gained, and we can reach more and different people through doing things online. And then there's other people that we need to reach through other ways. So I think we really have to consider everything. I'm really excited about the work that Mark's just been talking about. So in conjunction with Metro, with the council. So yeah, I'll be following that with interest and hoping to see lots of people getting involved. And just to say thank you really to everyone who's been involved in this tonight, to all the panelists, and to yourself, Joe, for chairing. And thanks to everyone who's watching, who tuned in, who asked questions, who left comments. And please do encourage other people. I am presuming that this will be available to watch afterwards on YouTube. So please encourage other people to watch it. And finally, I look forward to seeing people again on the 25th for our next event.
Thanks very much, Katherine. Thank you for those closing remarks. And I'll just, as the chair, just really warm thanks for the panel. Thank you so much for spending your Thursday evening with us. I found it a very, very rich discussion, lots of different ideas and hearing about lots of different parts of our diverse community and how we've been affected. And also just, yeah, I feel like we're sort of leaving on a hopeful note about next steps, and also just, yeah, in a quite a reflective way of you know, in a way, these are dire times. You know, we're in a crisis, but we really are, I think, pulling together the best we can. And you know, we've got lots of ideas of how we can better come together, and we've heard tonight. But also, yeah, I've just found the discussion very connective. So thank you so much for you know, bringing yourselves and telling us about all your different work and different perspectives tonight. So on behalf of Metro, also very you know, very pleased that Hounslow Council were able to do this with us and to host us. So thank you to Katherine and Richard in particular for that. Any last comments, Mark, or shall we sign off for the night?
I think we can sign off. Thank you all.
Great. Okay.